your periods feel overwhelming and impossible to manage? You are not alone, but you shouldn't have to suffer in silence. Abnormal uterine bleeding affects millions of women every day. It's not just a bad period, it's missed work, cancelled plans, exhaustion, and anxiety. If you've ever had to plan your life around your cycle, this video is for you. I'm Dr. Motahare, board certified clinical and surgical pathologist, and on this channel, The Art of Medicine from Anatomy to Diagnosis, I help break down complex medical issues into clear evidence-based insights. In today's video, we'll explore what defines heavy menstrual bleeding, also called menorrhagia, and why it matters. We will also look at its causes, how it's diagnosed, and what treatments are available. If this is a topic that resonates with you or someone you care about, don't forget to like this video, subscribe to the channel, and share it to help raise awareness. Let's get started. Let me tell you a real story. Meet Sarah, a 38-year-old woman who came to her gynecologist after struggling for months with heavy menstrual bleeding. She described periods lasting over 10 days, passing large clots, and needing to change pads every hour. It was taking a toll on her energy, mood, and work. Upon evaluations and ultrasound imaging, she was diagnosed with uterine leiomyoma, commonly known as fibroid, which are benign smooth muscle tumors of uterus and one of the most common causes of abnormal uterine bleeding in the women of reproductive age. My dear colleague and friend, Dr. Huri, which is an experienced gynecologist, performed the surgery to remove the fibroid. Then she sent the excised tissue to the pathology lab for confirmation. Under the microscope, I saw classic fibroid tissue, a well circumscribed hole with bundles of smooth muscle fibers, with no signs of atypia or malignancy. How heavy menstrual bleeding is defined? Heavy menstrual bleeding, which is also called menorrhagia, is defined as blood loss greater than 80 milliliters per cycle or periods lasting more than 7 to 8 days. Clinically, it's often recognized by symptoms like needing to change pads or tampons every 1 to 2 hours, passing large clots, or waking up at night to manage bleeding. This condition affects about 1 in 4 women, and yet many don't seek medical help. It significantly impacts daily life, productivity, emotional well-being, and can lead to iron deficiency anemia, fatigue, and dizziness. Now let's define what we mean by abnormal uterine bleeding, or AUB. It's a general term used when menstrual bleeding doesn't follow the normal pattern. In a healthy menstrual cycle, bleeding occurs every 21 to 35 days, lasts 2 to 7 days, and involves a manageable amount of blood loss, typically 25 to 80 milliliters. For most women, this bleeding is predictable and does not significantly affect their day-to-day life. In contrast, AUB refers to any bleeding that falls outside this normal range, that include periods that comes too often or too far apart, bleeding that lasts longer than 7 days, excessively heavy bleedings where you are changing pads or tampons every hour, or bleeding that happens between periods, after sex, or after menopause. That is very important, post-menopausal bleeding. It's important to remember that AUB is not a disease in itself. It's a symptom. And that symptom can point to a wide range of underlying conditions, from hormonal imbalances to fibroid bleeding disorder or even early signs of malignancies. Recognizing AUB early is key because the sooner we investigate the cause, the sooner we can treat it effectively. Now that we understand the definition of heavy periods and also AUB, let's talk about why they happen. The truth is, there is no one size fits all answer. That's why the International Federation of Gynecology and Obstetrics, FIGO, developed a classification system called HOLM-COIN to help doctors identify the underlying cause of abnormal uterine bleeding. HOLM referred to structural causes seen in imaging or histology. P stands for polyps, endometrial or endocervical. A stands for adenomyosis. L stands for leiomyoma or fibroid. And M stands for malignancies or endometrial hyperplasia. COIN includes non-structural causes. C stands for coagulopathies, bleeding disorders like von Willebrand disease. O stands for ovulatory dysfunction, which is seen in polycystic ovary syndrome or thyroid disorders. E stands for endometrial hemostasis issues. I stands for iatrogenic, meaning caused by IUDs or some medications like anticoagulants. And N stands for not yet classified. These classifications guide diagnosis and treatment planning. So how do we figure out what's behind heavy bleeding? It all starts with your story. We will ask about your cycle, how long it lasts, how heavy it is, whether you pass class, or how it affects your energy level or daily life. Keeping a record of your periods can be really helpful, and there are many free apps that can make tracking easy. Next is physical exam and often a pelvic ultrasound, which helps identifying issues like fibroid, polyps, or signs of adenomyosis. In some cases, a biopsy of uterine lining may be needed, especially in women over 40 or postmenopausal bleeding, or those with risk factor for endometrial hyperplasia. We also do some blood tests, some for diagnosis and the other for understanding the effects of that heavy bleedings on your body. These tests include a CBC, simple CBC, for understanding about anemia, your body iron levels, thyroid function tests, and if needed, tests for bleeding disorders, especially in younger women. The goal here is simple, to get a clear picture so we can offer the right treatment, not just symptom control, but a real solution. The good news is heavy periods are treatable and the options are more personalized than ever before. Whether you are managing occasional heavy flow or chronic menorrhagia, there are both medical and surgical treatments that can help. Let's start with medical options. Some of the medical options include NSAIDs, like ibuprofen, that not only relieve the pain but reduce bleeding by lowering prostaglandins level. The other ones are hormonal treatments, like combined oral contraceptives, progesterone pills, or hormonal IUD. These hormonal treatments thin the uterine lining and are highly effective, sometimes even more than surgery. When medications don't work, surgical options are considered. Endometrial ablation, which removed or destroyed the uterine lining. Myomectomy, which removes fibroid. And hysterectomy, the most definite solution, though it's usually reserved for severe or unresponsive cases. Choosing the right option depends on many factors, including your age, fertility goals, and exact cause of bleeding. That's why evaluation is so important. Let's not overlook the real-life consequences of heavy bleeding. One of the most common is iron deficiency anemia. If you've ever felt constantly tired, dizzy, short of breath, or struggled to focus during your periods, you are not imagining it. You may be losing more blood than your body can replace. But there is power in awareness. Keep track of your cycle length, intensity, and symptoms. If you are soaking through pads orally or passing clots bigger than a coin, that's not normal. Don't ignore it. Seek care early. Prevention also plays a role. Eat a nutrient-rich diet including iron from leafy greens, beans, and lean meats. Consider iron supplements if you're already feeling fatigued. Manage underlying conditions like thyroid disease or polycystic ovarian syndrome with your healthcare provider. Heavy periods are not something you should just put up with. They are treatable, and with the right support, you can reclaim your health, confidence, and peace of mind. And always keep in your mind that postmenopausal bleeding is not normal, not even one time. And you should seek for for care for doctor help as soon as possible. Thank you so much for watching this detailed guide on heavy menstrual bleeding, menorrhagia, and abnormal uterine bleeding. This presentation is based on latest scientific evidence and clinical guidelines to give you reliable, trustworthy information. If you find this video helpful, please like it and subscribe to the channel and hit the notification bell so you don't miss future videos. Feel free to leave your questions or experiences in the comments. I read them all and aim to support you on your health journey. Stay informed, stay empowered, and most importantly, stay healthy.